My name is Richard Nash. I'm one of the doctors at the Colorado Blood Cancer Institute. I'm a transplant physician, hematologist, oncologist. I was at the Fred Hutchinson Cancer Research Center at the University of Washington initially, and the program was growing here. My wife liked the weather in Denver, and so we decided to come here. I've been here now about 9 years, and interested in seeing patients with hematologic malignancies, but also we are doing studies and transplanting patients with autoimmune disorders as well. It's interesting that sometimes we see patients where they say that, it's the physicians who should be making the decisions about, kind of the care of patients and how we're going to be moving forward. But in my mind, it's really the patients themselves who are the ones who are going to be guiding us and telling us what they feel appropriate, what is appropriate for them in terms of the treatments that we're offering. In medicine, it's the care of patients and sort of the work that I'm doing. I'd say that in sort of more personally, it's cycling. I enjoy cycling, so I do a lot of that. Kind of a personal goal is I'm sort of stepping across the United States right now. So I'm sort of started in Seattle, I think 2 years ago now, and so I'm just sort of going across step by step across the United States and then up into Canada. So it's one of the largest transplant programs in the area. We have a large group of physicians who are dedicated to caring for patients. We have clinical trials that we offer patients. The depth of experience here is really quite remarkable. Most of us have trained at the Fred Hutchinson Cancer Research Center, which was one of the first centers doing transplants, now probably 40, 50 years ago. I'd say that the major thing that I've been working on recently is in the area of autoimmune disorders. So patients with systemic sclerosis and multiple sclerosis are probably the two areas where I think now there's a consensus, given the studies that have been done, that we should be transplanting these patients if they're failing other therapy. And then we're going to be sort of expanding our studies and clinical trials to kind of explore other autoimmune disorders that are failing therapy and seeing if transplants are appropriate for these patients. I think what drives the research really is sort of the interest in the patients and your interest in humanity, human efforts to improve our kind of daily lives and improving the lives of our patients with these severe autoimmune disorders. And these are autoimmune disorders which are life-threatening. These are patients who have failed other therapy. So I think that there's a large unmet need for better treatments for many of these patients. So.